Welcome to the deep dive. We're here to look into your sources, cut through the noise, and, well, get you properly informed. Today we're tackling lipedema. It affects millions of women, but it often goes misunderstood. Sometimes for years, you might just think it's, stubborn weight. But the sources you sent paint a really different picture, often painful, but also, thankfully, with effective non-surgical treatments available. Our mission. To clarify what lipedema actually is, why it's so often missed, and how you can proactively manage it. Okay, so let's unpack this. What exactly is lipedema?
Right. It's a chronic disease, progressive too, and it overwhelmingly affects women. We see this disproportionate buildup of fat tissue, symmetrical, usually on the legs, sometimes the arms too, and it's often painful.
Painful fat. That sounds unusual.
It is, and it often kicks off around puberty or, other big hormonal changes.
And critically, it's not just ordinary weight gain, right? You
Mhm.
mentioned specific features.
Exactly. Like the bracelet effect people talk about at the ankles. The fat kind of stops abruptly there, so the feet themselves are spared. It's quite distinct. And here's a really fascinating part. This isn't fat like you see with general obesity. It's actually considered a disease of the loose connective tissue. That's the sort of scaffolding under the skin.
Ah, okay, so the underlying structure is different.
Precisely. And that's why it's so resistant to normal dieting and exercise. You might lose weight from your upper body, your torso, but the limbs stay disproportionately large.
That must be incredibly frustrating.
Extremely. Another key thing doctors look for or feel for are these nodules under the skin. Sometimes they feel like, well, frozen peas or little pearls.
Wow.
And yes, that tissue is often tender, painful, and bruises very, very easily,
That distinction is so important because, as you hinted, it gets confused with other things all the time, like obesity or lymphedema.
all the time. And that misdiagnosis causes real problems.
So why the mix-up? What are the telltale differences?
Well, the symptom overlap can be tricky, no doubt. Lymphedema, for instance, usually causes swelling in the feet and hands, which lipedema typically doesn't. And lymphedema often has what we call pitting edema, press the skin, and an indent stays.
Okay, got it. And obesity?
Obesity is generally more proportional fat gain all over the body,
Yeah.
which is why the standard BMI calculation isn't actually that helpful for diagnosing lipedema. It just doesn't capture that limb disproportion.
So BMI can be misleading here.
Very much so. Waist to height ratio.
Mm.
That tends to be a better indicator for lipedema. And all this confusion, this misdiagnosis, it leads to a lot of psychological distress. Patients feel blamed like it's their fault when it's a genuine medical condition.
Absolutely. And that really highlights why getting the right information out there is crucial. So given how complex it is and how often it's missed, I can see why people might think surgery, like liposuction, is the only real fix. But your sources strongly suggest non-surgical options are very viable. Tell us about those. What can actually be done, realistically?
Yeah, that's a really important point. What are the options beyond surgery? First off, treatment needs to be totally individualized. What works for one person might not for another, but non-surgical conservative therapies, they're absolutely fundamental.
Okay, like what?
Compression therapy is a big one, using specialized garments, maybe flat knit ones if it's more advanced, they give more consistent pressure.
And that helps shrink the fat.
No, not directly. It's primarily for managing pain and providing comfort, supporting the tissues.
Ah, okay. Comfort and pain. Makes sense. What else?
Manual lymphatic drainage, MLD. It's a type of gentle massage that can help with pain and, encourage lymphatic flow.
And exercise. Is that helpful or harmful?
Gentle, low-impact exercise is highly recommended. Think swimming, water aerobics. It's great for mobility and pain, doesn't stress the limbs too much.
Good to know. What about diet?
Diet's interesting. Things like anti-inflammatory diets, maybe low carb or keto,
Yeah.
they can definitely help manage inflammation and overall health. They might not, dissolve the lipedema tissue itself, but managing inflammation is still a big win for symptoms and well-being.
So diet helps manage symptoms, not cure the fat itself.
Exactly. And while diuretics usually aren't the answer, some supplements might be considered, like diosmin, which can support vein health. Ultimately, it's about putting together a comprehensive plan, often with different specialists, tailored specifically to you.
That's genuinely empowering to hear that non-surgical paths offer real, tangible benefits. So if you're listening and any of this resonates, if you suspect you or maybe someone you know has lipedema, please know there are ways to manage this. Improving quality of life is possible. Self-management, finding the right professional help, and importantly, addressing the emotional side of things. It's all part of it. It really is okay to kind of reset and start fresh on your health journey with this understanding.
Absolutely. And knowledge is key, right? Understanding what's happening is the first step. Lymphedema might not have a cure in the way we usually think of it, but a personalized approach, one that focuses on managing symptoms, staying mobile, feeling better overall. That can make a massive difference in someone's life, truly transformative.
So what does this all mean for you listening right now? Understanding lipedema goes beyond just knowing a medical term. It's about seeing the very real, very personal struggle that millions face, often feeling blamed or dismissed. What if really embracing the complexity of conditions like this one and championing this kind of multidisciplinary patient-first care? What if that completely changes how we think about health, our bodies, and even self-acceptance?